How many treatments is it? Like, so let's say I come into you in January and I'm in pretty good physical shape. I just have one target area. How many times am I going to need to see you, and when am I going to start to see results?
It depends on how big that area is,
Okay.
but you do need at least 2 sessions.
Okay.
Every patient, any area of the body, you're gonna need at least 2 sessions. So it depends on how big the area is, where the area of the body is, especially for the underneath the chin area. The treatments take at least 35 minutes. The longest treatment area, which would be the outer thigh area, takes about 75 minutes.
Oh, wow. Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Sayla, a Californian through and through, and we're your co-hosts.
That's right. We're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts.
Hey, Sayla, have you seen those ads for CoolSculpting?
I have seen them everywhere.
Do you even know what it is, though?
I know a little bit about it, but not really. I have to admit, I get very skeptical and because, I was a personal trainer. I don't like quick fixes.
You want something that's like, okay, I'm going to put in the time, I'm going to put in the work, the energy, and make it a lifestyle change as opposed to a quick fix, right?
But yes, but that being said, I do want to know, is this something that would last, for example, and could help with those areas that you cannot spot reduce by training? You know what I mean?
Yeah, no, that's smart. That's smart. And I feel like when I see the billboards for CoolSculpting, it can be misleading because it does seem like, oh, this is just a quick fix. And I've heard people talking about it, but I don't know anyone who's actually done it, or if they have, they haven't told me.
No, I don't either.
So that's why I'm looking forward to talking to our guest today. Victoria Hernandez is going to be joining us. And Victoria is a CoolSculpting specialist at Face and Body in Upland, California with Dr. Edward Park, where she's been practicing for more than 7 years.
Wow. Yes, she's been a nurse for 7 years and attended CoolSculpting University.
Yeah, CoolSculpting University is a real thing.
That sounds really cool.
I see what you did there. But she's going to be the person to talk to about it because she's the expert and because she's going to tell us whether or not we would be good candidates for it.
Let's find out.
I bet, you know what? I bet it's not a quick fix.
No, I bet you're right. And I shouldn't judge because, who knows? I'm very curious to find out.
So am I. Let's go ahead and bring Victoria in.
Let's bring her in. Hello, Victoria.
Victoria in the house. Welcome to the pod. We're so glad to have you here.
Thank you. I'm so excited to be here.
Good.
You're going to teach us so much today.
Yeah, we're talking about CoolSculpting with you. But before we jump into that, we want to know how you got started into just the cosmetic industry.
Yeah. Well, I've been a nurse for 7 years, and what pushed me to literally just engage and go into healthcare full on was COVID. I did a shift change, and I shifted onto plastic surgery.
Okay. What made you do that shift?
What made you lean into that?
It was just an opportunity that was there, and it happened out of nowhere. And I was like, you know what? If I don't jump on this right now, then I don't want to miss this train.
That's awesome. Well, and tell us about one of your favorite techniques. Is it CoolSculpting?
It is CoolSculpting. I'm a CoolSculpting specialist.
What is CoolSculpting? Break it down for us.
So CoolSculpting, it's very different. I mean, people think it's just like a one and done type of thing. Okay. So it freezes the fat internally, those cells, the cells that we actually put the applicator on. And once we freeze those cells, it gets under 110 degrees Celsius. So it is very cold freezing process. It is a very long-term process of how it affects your body. It takes 4 to 8 weeks initially to actually get out of the body.
Whoa.
And it escapes throughout your lymphatic system. So
what does that mean?
So you're going to literally drink water. I tell my patients all the time, hydrate 24 hours before and hydrate actually 48 hours after. Wow. It's a very crucial process because if you don't hydrate, then it's not going to push anything out of the urine system.
Oh, so it's through the urine. Mm-hmm. Okay, that is so interesting.
It is interesting. Why would someone choose CoolSculpting versus other procedures?
So for CoolSculpting, it's a very non-invasive, so no downtime. You go to the gym right after, go in the sauna.
Really?
Same day?
Same day.
sauna?
What?
I would think that would be like not okay with the
Yeah,
cold
like
and the hot.
counterintuitive to like the effects you want to have.
Yeah.
No, it does not actually hurt whatsoever.
Oh my gosh.
Oh.
So it's non-invasive, but it's 100% effective? Like
It is.
Oh, wow.
Yes. So, I mean, like I said, it's going to be a patient process. However, within those 4 weeks, you're going to see that area go down. I tell my patients, don't look at the scale when you're doing CoolSculpting because it's not going to affect it as much. You're going to lose inches in your body compared to the scale.
Oh, wow. So people lose inches rather than pounds.
Yes.
Okay. But there's always results.
It is. There's always results. I mean, there's probably that 1 in a million person that will have a counteractive result. But out of all my patients that I've treated, they've been happy.
And the results last?
They're long lasting. They're permanent.
Oh, I did not know that.
Yes, those cells in that area, they're permanently gone. You're not going to gain any new cells if you happen to gain weight. Now, those cells either will shrink or they'll go ahead and expand if you gain weight. After the age of 25, I don't know if a lot of people know this, but you don't gain any new fat cells in your body.
Did not know
I
that.
did not know that. Which parts of the body are you targeting when you're doing a CoolSculpting procedure?
So it depends on the patient that's coming in.
Okay.
A lot of my patients really want to go ahead and target that lower abdomen area. So it's going to be that pooch that all of us women have after, of course, having kids or anything like that. A lot of patients actually do the inner thighs as well.
Oh, wow. Yeah, I would love to do that.
Are there any other parts of the body that you focus on?
Oh yeah, of course. So we can do the underarms right here. We can go ahead and do the banana rolls, what we actually call
The banana rolls?
Banana rolls are going to be the lower buttocks area.
Oh, why do they call it the banana
don't
rolls?
know.
I've
It's
never
just like
heard
a
that.
little banana.
looks like a
looks
banana?
like a banana.
Oh my goodness.
That is okay. And again, if you were to gain, like, let's say you do all this and then, oh, I've been eating bad, I gained 10 pounds, then what happens?
Those cells are still going to eliminate, but you're just prolonging how your results are going to look.
Oh, and does the fat go elsewhere, like your face or something like that?
It won't go elsewhere. It's just you're gaining those cells that we have. Like I said, they're just going to expand a little bit.
How many treatments is it? Like, so let's say I come into you in January and I'm in pretty good physical shape. I just have one target area. You know what? Let's say I have my banana flaps. Is that
Banana
one?
rolls.
Banana flaps, banana rolls.
Same
But
thing.
I want you to focus on my banana rolls. Okay, so I come in January. How many times am I gonna need to see you, and when am I gonna start to see results?
It depends on how big that area is.
Okay.
But you do need at least 2 sessions.
Okay.
Every patient, any area of the body, you're going to need at least 2 sessions. 2 cycles is what we call it.
Okay, is it painful?
I
And
was
how-
just gonna ask
I
that.
know. And how long does it last? Like the procedure itself while you're doing it?
Yeah.
So all the applicators are different. There's Petite, Advantage, and then Advantage Plus. So they're all the areas of the body. So it depends on how big the area is, where the area of the body is, especially for the underneath the chin area. That's also what we do.
Oh.
That's going to be a mini. So the treatments take at least 35 minutes. The longest treatment area, which would be the outer thigh area, takes about 75 minutes.
Oh, wow. And does it hurt? Is it painful?
It does not. So what I explain to my patients is when I go ahead and put the applicator on, before I do any of that, I go ahead and wipe the area with a wipe that takes all the excess body lotions, oils, anything that you might have on your body pre-becoming in for your appointment. And then I go ahead and put the gel pad on, which that helps with any frostbite. Because we don't want to go ahead and put that on since it's getting super cold.
Right.
So it helps that body area. And then when I put it on, when I actually turn that applicator on, it's going to go ahead and suction in the area, unless you're doing your outer thigh. We're just putting a whole platelet on there with the gel pad.
Oh my
Okay.
gosh.
And then you're going to be a little bit cold. It might feel a little uncomfortable. There might be some stinging or anything like that, but it will go completely numb.
Gosh, that's so cool.
What kind of results have you seen that are wowing you, that keep people coming back?
Ooh, that is pretty hard. It depends on my male patients and my female patients.
Okay.
But I love doing the flank area. Your bra fat, underneath the bra fat area, those flanks, they see amazing results. That and then the inner thighs. You'll
I
see
want to do
results
the inner
very-
thighs. Can
yeah.
you do that?
Oh, yeah, come on down.
Did you bring your instruments? No, because she will really do
I'll
it
do it
right
right
here.
here.
Like we will do it right here.
The machine is heavy.
Yeah.
Oh, really?
Yes.
Okay.
Well, the machine itself, not the applicator.
Right,
but
right.
yes.
Oh, wow. Now, how do these results with CoolSculpting compare to traditional procedures people are doing, like liposuction? How can we compare and contrast?
So it just depends on how the patient, what they're getting ready for exactly. Do you have an event in a month? Do you have an event in 6 months to where you're going to get that result, what you want, and you're going to be looking great?
And
No
have
matter
the time to recover,
Ex-
right?
and have the time
okay.
to recover. I mean, it just depends on what the patient, what they're looking
man.
for.
Well,
And
this
with Cool
sounds-
Sculpting, you don't need all that time for recovery.
Yeah, and you know what? Actually, for patients that cannot have surgery, it's a great, great way.
alternative.
Alternative, yes.
It also sounds much more palatable.
Oh yeah.
You know.
So if I've had some Cool Sculpting done before on the flanks, as you say, and am I going to have to come back like 6 months later or a year later to have it redone, or is it done once it's done?
Usually it is permanent.
Oh.
So it just depends on if you want like a little touch up. You can
Okay.
do that touch up. However, like I said, if you're gonna come with your flanks, anybody if they come back for a little touch up, it's gonna be a different area.
Okay.
So timing wise, when is the best time to get Cool Sculpting done? Let's say I have a wedding I'm going to. Is it several months in advance, several
Yes.
weeks in advance?
If you have a wedding and it's 3 months down the line, it's gonna be okay. You can come within 3 months, but what result are you looking for? I want to make my patient happy.
Sure.
So try to time it with you first, like
yes.
6 months or whatever.
Give yourself more time as opposed to
Yes,
less,
yes.
for sure.
Oh,
What
definitely.
Are there side effects or things
Oh,
that
yeah.
people should be?
There can be side effects. I do tell all my patients prior to doing the procedure, if you are having any swelling after, any late onset pain, so that's like, let's just say they leave the office and then later on that night they have like a stinging pain or a little spasm, then I give them our work number. They'll go ahead and text, hey, there's, this late onset pain.
How is it's very costly, these procedures?
Unfortunately, it is, and people are very surprised when they come in the office. They think it's going to be $1,000. And unfortunately, that's not the case. It can be pricey.
Okay.
The highest that I have seen that it can get would be about $8,000, and that's probably like 12 cycles.
Is that like an all over the body kind of treatment, or you're talking about focusing on one area?
Yeah.
It can focus on 2 areas. So like what I do for my patients specifically for the lower abdomen, I don't just want to put one whole applicator on there. We're going to go ahead and dissect it in 2. To make sure we're getting both of the treatments, we're going to do it at least 2 times, like I said, depending on the person or how that area looks. We do want to make sure we're maintaining that treatment in the same area and going over it to where it's fully going to go down in one.
Okay, so that's where can you finance this?
You can actually. You can definitely finance. We have financing options. Just because it is a bit of a costly for patients that think it's going to be, like I said, $200,
$1,000.
$1,000.
Yeah.
I mean, they definitely have financing options with us. That's what I always let them know. Like, hey, you don't have to just pay
You take
all of your savings up in one front. You can do it monthly payments with the credit card.
CareCredit credit card.
So would you recommend different treatment combinations depending on the patient? So like
Oh, yeah.
maybe we'll target this area with some Cool Sculpting. You need 2 sessions of this, and maybe we'll do something different with this
Yes.
part of your body. How do you customize a treatment plan for a
so
patient?
for my patients, I mean, there's different types of patients. However, what we can do for them, if they're targeted for, like, let's just say the chin, and we get that chin to a really good area, but it's just that small, tiny amount that we can't get with the applicator, then I'll send them over to my injector, Jeanette. She could do Kybella in that area, and it's a great combination.
Okay, so you can combine with fillers or
Oh, yeah.
Botox or whatever.
Not Botox, but yes, definitely Kybella.
Not Botox.
Remember, we know that Botox is here and up.
Oh,
Yes.
right. Thank
We
you.
learned that right here
Yes,
on
yes.
Care Experts. Now we're the experts. Not really. That's why you're here. That's why you're here.
Yes.
What I always get concerned about when I hear about people going in and have like major treatments, they think, okay, I'm fixed now. I don't have to worry about anything. I paid
have to
this
work
money.
out.
I don't have to work out.
Eat right.
Yeah.
Yeah.
What advice do you give people for maintaining the results that they've just invested in?
Oh, yes. No, definitely. I mean, when they're maintaining the result, diet and exercise, that is
You
the
hear that a
main
lot.
thing. the
Cannot
main
escape
thing.
it.
Yes. Even when they're doing the process, please diet and exercise. That's going to help you achieve your goal faster than me.
Yes. And keep your results.
Yes.
Maintaining that, yeah.
Absolutely. So, how do you choose a provider for something like this? How do you find you?
Well, you definitely want to ask them when you're going to your first consult. Make sure that they are not licensed but certified. They went to Cool Sculpting University. They went to Cool Sculpting classes.
Okay.
You want to make sure that their rep has been with them for trainings, and they've done at least 3 trainings with a provider and a model. You want to make sure that they know what they're talking about. That you're actually comfortable with your provider.
I also have heard, okay, so there's cold sculpting, which we've been talking about. How does this compare to the other? Wasn't there one that burned the fat, like a laser heat treatment years ago?
Oh yeah. Well, we actually sell not a laser, but it's called Exilis. So that's
Yes.
also what I do.
Okay.
I'm an
what is
Exilis
that?
specialist. So
Oh.
Of course you are,
Yes.
Victoria.
I mean, I could. So another combination with that is a great Exilis combination.
Okay.
So Exilis is going to be a warm heat treatment.
Yes.
The only reason why a person wouldn't be a candidate for it is if you have any metal in the body, like a metal rod or
Oh,
plates,
that makes sense.
anything like that. Because it is done with electromagnetic waves in the body.
And that burns the fat, or what does that do?
It melts the fat away.
Yes.
So the heat, all that heat is melting the fat. It's also helping boost your collagen in the skin and firming and toning in that area.
So that the cellulite goes down and stuff,
Not
right? Or no?
cellulite,
Okay, oops.
unfortunately. We don't
Promising.
have that just yet, but
Okay.
it does help tone all that area.
Well, and they combine it sometimes with that lymphatic drainage thing. I think that's
Yes.
where I was thinking about.
Oh,
the
no, yeah.
cellulite.
So, like, they can do Exilis and then the lymphatic right after.
Whenever I want to know about these kinds of procedures, I know I'm not alone in this. One of the first places I turn is to social media. I'm just going to type in there, and that's my search engine for before and afters.
Yes.
Are you the kind of person who has before and after pictures that you show your patients, like, this is what I can do?
Yes.
You're talking about wanting to have this specific area. I've done this specific area before.
Okay.
Is this your desired look?
Yes.
You do that?
Oh, yes. I take
wow.
before and afters of all my patients before, during, and after,
Oh,
actually.
cool.
If you want
okay.
to see that process, go ahead and go
Yeah.
along to see if it's actually working, which, I mean, of course, it's going to
Of
work.
course.
But we want to show the patient, hey, look, this is how you looked in the beginning. This is how we were doing during your procedure, and then right after.
Okay.
And then we make sure that that's actually their goal.
But you said now Exilis and CoolSculpting, they do not help with cellulite.
They don't.
They don't. So what can you do for
Unfortunately.
cellulite?
Right now, there's nothing we can really do cosmetically for any cellulite removal. We don't have that in the office, at any office.
Okay.
But I know a little secret, it might be coming out.
Oh.
Tell us.
We have to wait. We have to wait
Oh.
for that.
It's
Is it?
embargoed.
You can't tell us
It's
the secret.
embargoed. She can't tell
this is
us.
top secret.
But that means that there's hope.
And we have to have you
There's
back.
help, yes.
Yes. So every episode we have listener questions for you. You are the expert.
You are the expert.
Yes. Let's see. Would you like to start, Melissa?
Certainly.
All right.
Let's start this. This is time for Ask the,
The
expert.
Expert.
All right.
Yes.
So this person says, I'm super sensitive to cold. Will I have a hard time with the procedure? Of course, the procedure being CoolSculpting.
CoolSculpting.
Yes. If you're very sensitive to cold, the question I would ask that patient is, are you sensitive to frostbite? Do you get frostbite when you go snowboarding? Things like that. Because if you do, then that would not be the procedure for you, unfortunately. Now, if you're just a little bit sensitive to cold, I always give my patients blankets. If they need fuzzy socks, we got fuzzy socks for you. Anything to
cool.
make them comfortable.
Okay.
Is this procedure done standing up or are you lying down?
Laying in the bed. Never standing up.
Oh, I don't know why I thought it was done
I thought it was
standing.
standing up,
Oh,
too.
you
I
did?
pictured that.
Yeah,
Yeah.
I pictured it like you're standing and y'all come in. I mean, you
Sculpt
cool
you.
sculpt
Yeah,
me.
exactly.
You know,
Like a spray tan.
No.
Oh, well, I haven't had a spray tan, honey. This is year round.
No,
But
but
I
I
know
pictured
what
the
you mean.
standing,
Yeah,
like you
yeah.
said.
I wonder why we both thought that.
I don't know. That's funny. Well, like a sculptor.
Yeah.
But lying down sounds much better.
Yeah, and you're in your
Relax.
cozy socks.
No, honestly, some patients do take
I
naps.
would take a nap. I'm so
What?
sleep deprived.
What?
We have Netflix, the whole nine.
What? Oh,
me up.
say less.
Sign me up.
Okay.
Okay, this next person wants to know, is CoolSculpting a good follow-up treatment from a mommy makeover or tummy tuck?
Oh.
Tummy tucks, I wouldn't necessarily do, only because they're so pulled down. Like Dr. Park, he does a contoured abdominoplasty, and he does an amazing job. So
Okay.
I would not touch that lower belly area. Now, if they want to do their flanks, or if they want to do the arm area,
inner thigh.
or inner thigh, like I said, yes, I'll definitely go ahead and treat that patient.
Okay. Well, good to know.
Okay, who do you see more? Do you see men typically doing cool sculpting or is it women?
A lot of women, but I do have a lot of men patients that are very happy that
Oh.
do
Gods.
that.
What
Yes.
areas do you target in men mostly?
Flanks and lower abdomen.
Oh. Okay.
Dad bod.
The dad bod.
yes.
It's not just
get rid of
mommy
that.
who needs a makeover.
Yeah,
Daddy
yeah,
wants to change this
that
dad bod.
sometimes too, yeah.
That is right. Okay, this person wants to know, can CoolSculpting help me look more toned?
Oh,
It can. It
How?
can. Depending on the area.
okay.
Unfortunately, it's not going to sometimes work for the lower abdomen because that's this very, very stubborn fat, unfortunately. But for the flanks, like I mentioned, that is literally my favorite.
It's-
But it will make you look very sleeked and toned.
Oh,
That
nice.
contoured look in the back.
Yeah, the V.
Mm-hmm.
Yeah, I know what you're talking about.
Okay, here's our last question. Do I need to follow a strict diet or take supplements to prolong my CoolSculpting treatment?
Great question.
You don't need to take any supplements. Diet, like I said, if you're just eating healthy, not eating junk all the time, it'll help prolong it, of course.
Have you ever done CoolSculpting?
I have. I've done it on myself. I've done
On yourself?
I have. Well, I've had the help of a fellow
Of course.
Oh, right,
You can only
right.
reach
Other
like,
cool sculptor.
Yeah.
Yes. I've done my lower abdomen actually.
You saw great results?
I did. I've only done it twice, and I don't need it anymore.
Amazing. Oh my gosh. Well,
Can you, this is probably such a silly question, but I feel like somebody who's listening right now is probably thinking this. So if you're freezing it, and you said eventually it goes numb, does it stay numb forever?
Not forever.
Okay.
Good question, actually.
Thank you.
But when I take that applicator off, sometimes another side effect of it, you can be numb for up to 2 weeks. I've had a patient be numb for 2 weeks. He was actually a male. And then after, your sensation will come back.
Oh, okay. That's good.
Yeah, it will come back. It won't be gone forever.
Okay.
oh, wow. Is there anything else you want to share with our listeners?
That we didn't ask you?
Yeah.
About CoolSculpting, about why it could be.
Exilis.
Yeah, or about Exilis.
Oh, yeah, let me go over Exilis a little bit more with you.
Sure.
It is a great way to actually maintain any like mommy makeover or any liposuction. It is a great way to go ahead and pair that with.
Exilis is.
Exilis,
okay.
yes.
Okay. Versus the CoolSculpting. Great. That's great to know. So if you
Sometimes patients aren't candidates for CoolSculpting. Sometimes that area is too small. So then we can go ahead and go over that with Exilis. That's a great way to go ahead and go.
Oh, nice. Okay.
How long would you have to wait if you've had a mini tuck or a full tummy tuck, and you are now a good candidate for Exilis? How long would you have to wait until you're cleared to be able to have that procedure?
At least a month.
At least a month.
Okay.
And there's no openings, nothing like that.
Okay.
And how much does Exilis cost?
Yeah.
Good question. Exilis can cost up to the same as CoolSculpting. Now, actually, that does run from a little bit over $1,000, $1,500, I want to say,
Okay.
and the most I want to say it would be like $5,000,
Okay.
depending on how many treatments you need. Now, with Exilis, you do need at least 4 sessions, and it's
wow.
7 to 10 days apart. So it actually works quicker, and you can see results right away.
Oh, wow. And you can use the CareCredit credit card for that
Yes,
too?
yes, you
Okay,
can.
wow, great. How nice.
Victoria, thank you so much.
Thank you so
Thank
much
you.
for all
Great
of this
having you. Will you come back when we
information.
have more questions? Oh, no, you have to come back.
With her
I will
top
come
secret
back.
With
information.
her top secret information. 'cause
Cellulite
we want to
removal.
know. Yes, we want to know
Yes.
all about that. There is hope out there for you, and one day we will have the answers
One
right
day
here
we will
on Care
remove your
Experts.
cellulite.
We will remove your. Well, we won't do it.
No, we won't. Victoria will.
Yeah, Victoria will, or she'll tell us how we can get it done. Thank you again,
Exactly.
Victoria. We appreciate
Thank
you.
you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.